We are continuing our discussion on the coronavirus or COVID-19 pandemic, and with new case numbers still high due mostly to the Delta variant, but starting to drop a little throughout the country and here in Orange County, many residents are questioning what we should do next. Orange County government is suggesting that all residents wear face masks again while indoors, and many companies are issuing vaccine mandates for their employees. So what does all of this mean for you? Well, on this special edition of Healthy Connections, we're going to get an up-to-date look at where we are as a community dealing with this pandemic. Let's get an update from our state medical professionals, and joining us is Michelle Persaud, Epidemiologist Program Manager with the Florida Department of Health in Orange County. Michelle, thank you for being with us today.
Thank you, Clarence, for having me.
So, Michelle, tell us about the Delta variant that we're hearing so much about. Is it more contagious and more severe than previous variants?
Sure. So the Delta variant currently makes up over 90% of cases in the United States. That same percentage can be reflected in Orange County as well, where at least 90% of our cases are attributed to the Delta variant strain. Now, Delta variant is 2 times more contagious than previous strains such as Alpha or the original variant that caused COVID-19 infections. And so the Delta variant, several studies have shown that Delta variant cases can lead to increased hospitalizations, mainly amongst unvaccinated groups. But in terms of causing severe illness, it's roughly estimated to have around the same symptomology as previous strains. But again, the vaccine is what helps protect and reduce hospitalizations, as we have seen the Delta variant has attributed for a majority of these hospitalizations currently.
Wow. And are there other variants on the horizon?
There are always variants that we are surveilling, variants of interest and concern. And so we're always constantly monitoring other variants that may be introduced into the community setting.
Over at Camping World Stadium, they are doing monoclonal antibody treatments. Tell us what that's all about and who can get those treatments.
Sure. The monoclonal antibody treatment at the Camping World Stadium is available for those 12 and up, and it is free of cost, and it's a treatment used to reduce severe illness with those infected currently with COVID-19.
And can anybody get that treatment? Is it for anybody who's got coronavirus?
Correct. Anyone who has current infection who are 12 years or older.
And how about schools? Now that school is back in session, are they doing contact tracing, and are schools reporting the coronavirus cases correctly?
So schools are reporting coronavirus cases that they receive from parents. And so we do have a real-time reporting system established with the school board. And so these notifications do come on a timely basis. And contact tracing, once we receive those notifications, contact tracing is done in a timely fashion. However, there are some barriers, such as producing seating charts and the confirmation of a positive laboratory confirmed case. But other than that, schools are working diligently, as are the contact tracers, and making sure that we can identify those who have been potentially exposed and recommend for quarantine as quickly as possible.
And you know, Michelle, we could never say it enough. Tell us, what should we be doing as far as keeping ourselves and our families safe during this pandemic?
Sure. So what we all can do is to make sure that we are still practicing pandemic precautions, such as wearing a mask in crowded indoor spaces, as well as making sure that if we suddenly develop symptoms, we go get tested, depending on your exposures to confirm disease or not, so you can isolate effectively away from others in workplace settings and also household members. Also, the common practice of hand washing is also helpful in reducing the spread of disease transmission, not just COVID-19, but other diseases as well.
Well, Michelle, thank you so much for being with us today. We appreciate your time.
Thank you so much, Clarence.
We'll be right back with more. Stay with us. Let's continue this discussion with our local medical professionals, and joining me now is Dr. Yolanda Martinez, manager of Orange County Health Services Department. Dr. Martinez, thank you for rearranging your schedule to be with us today. We appreciate your time.
Oh, no, on the contrary, thank you for inviting me.
You know, Dr. Martinez, it seems like it was a long time ago, but just a few months ago, we were doing so well with the case numbers dropping, the vaccines, people were taking vaccines, and then along came the Delta variant. How are we doing now in Orange County?
Well, we're not doing as good as we were before the Delta came around. But interestingly, in the last week or so, the numbers seem to be improving a little bit. I don't know if finally people understood how devastating the Delta variant can be and are taking more precautions. The vaccination numbers still remain pretty stable. There hasn't been a big increase there, but I think probably people are taking a bit more the situation a bit more seriously and being a bit more careful. Certainly wearing the masks and social distancing continue to be the best option if you're not vaccinated, and vaccination is by far the best option.
Is there anything that we should be doing differently? I mean, I know, like you said, people are starting to take this more seriously, but is there anything else? Because things change all the time, and that's pretty normal when you're in a war, and we're really at war with this virus. So what should we be doing right now to keep ourselves and our families safe?
It's very simple, and I think many of us have been doing that and exercises since the beginning of the pandemic last year, and that is to continue to not let your guard down, continue to wear your mask, continue to social distance, continue to have a responsible behavior, because we don't live in a little bubble. We are part of the entire society. So there isn't really anything magical about what we should be doing differently, except that we need to just stay on it. It's simple to get tired and say, oh my God, I've been doing this now for too long, I don't want to do this anymore. But the fact of the matter is that as soon as we let our guard down, invariably something is going to happen. It's not going to be good. So continue to wear your mask, even if you're vaccinated. Wear your mask. That doesn't hurt in any way. Observe social distance, observe good hygiene. Do not touch your face, do not touch your mouth, which are always and have always been ports of entry for viruses. So just stay on it for a little longer, be strong, and continue doing what needs to get done.
How is the Orange County medical infrastructure working to make sure that residents of Orange County, particularly in underserved areas, are having access to the vaccine?
Well, we are working with our healthcare partners, and we know the hospitals and other healthcare facilities are providing the vaccine as well. And we have a vaccination site in the downtown area, which is open 7 days a week from 9 to 5, which is convenient for those that work early, for those that leave work early. And so it gives a flexibility there, in addition to being open on the weekends for individuals that are not working on the weekends that are working during the week. We also have the availability if somebody calls us and lets us know if they're going to bring a group of individuals via a bus or walk in. We'll be more than happy to make that arrangement, so it doesn't just have to be a car that drives in. So we're trying to work not only with our healthcare partners in the community, but also within our resources. And then also keep in mind that we have the 3 testing sites available to facilitate individuals knowing if they're positive or not, and thus being able to take more precaution.
So we now have this situation where some people are vaccinated and some people are not. So how do we know, is there still a push to get people tested for the coronavirus? And should you be tested if you're starting to feel symptoms and you have been vaccinated?
Yes, there's still a push for the testing because, as you know, I think we're at, based on the latest numbers from the Department of Health, as of right now, we're about 70% vaccination, full vaccination for our county, which means there are about 30% of our residents that are not vaccinated. So testing is critical because testing is what lets us know how the virus is doing in our community, how much transmission, how much community transmission there is, which again gives us an idea of what other interventions need to take place, what more education we need to give. So that is critical. Even if you're vaccinated, and we've heard about this, there are situations in which there are breakthrough infections, and that is the individual who's vaccinated can still get the infection, might not necessarily have the symptoms that a person that is not vaccinated will have, which makes it even more dangerous because you could be walking around with the virus and transmitting it to other individuals who might be vulnerable, that for some reason or another have not been able to get vaccinated, and that being children under 12 years of age, maybe some of the elderly that got vaccinated at the beginning of the vaccination phase, and maybe the vaccine is starting to wear down a little bit in its efficacy, so you might be exposing those individuals as well. So again, as we said at the beginning of the interview of our conversation, it is important that we take into account that we don't live in a bubble. We're not isolated. All of our actions have reactions and repercussions in every one of the individuals we interact with on a daily basis.
And for people who are unsure, are the mask recommendations, I don't want to use the M word, but are the mask recommendations, are they having an effect in keeping the numbers steady or going down?
Yes, we think they are. We have seen some instances, although we can't say officially, because there's no way to say exactly this is what causes this other action. Or reaction, this action causes this reaction. But we have seen that since the mask mandate in the school situation, for example, for about a week or so, the numbers have not increased. So one could therefore try to make some connection and say, yes, it is a positive. We also saw it, and you know, if we don't want to use that example, we saw it at the beginning of the pandemic when the mayor made the mandate of masks in our county, and we saw the infections halting and that having a very good effect. So there are more than one examples of situations in which we can say and know that wearing a mask and masking and social distancing are the key. In addition, obviously, to the nationally recognized agency, the Centers for Disease Control and Prevention.
It's just a mask. Thank you very much. Thank you very much, Dr. Martinez. It's always good to see you. Thank you.
Same here. It's a pleasure. Thank you.
We'll be right back with more. Stay with us. We've heard from a variety of leaders today trying to keep us informed about the coronavirus. From local government, the medical community who's on the front lines dealing with this pandemic, and organizations who continue to serve this community. And of course, we are also here to help you keep making those healthy connections. Stay safe.